Hello, and welcome to Timing is Everything, a program of Care Dimensions, formerly Hospice of the North Shore in Greater Boston. My name is Mary Crow, Education Specialist at Care Dimensions. Today, I am so pleased to have on the show Ellen DePaula, who is the President and CEO of Honoring Choices, Massachusetts. Ellen, welcome to the show.
Thank you, Mary. It's a delight to be here.
Thank you. So, tell us a little bit about yourself.
Well, I'm a guardianship attorney, so I come to the work about healthcare and healthcare planning and information through the law, which is a little different than most of them are medical and community providers. For many years, I actually worked in community service, and then later in life, when my children moved along, went to law school, and then combined the two, the work in community service and the law, to see if we could help people do their own healthcare plans and get connected to care in their community.
Oh, that's great. And again, I'm so excited to have you on the show. It's such an important topic, and you certainly are out there advocating so strongly for people to get their wishes in order and such. So tell us, April is a pretty special month, so tell us more about that.
Yeah, we're very excited. April is Healthcare Decisions Month in Massachusetts. Actually, April 16th is the national day where everyone in the country thinks about what they want to make for their own healthcare plan. But in Massachusetts, we got really excited about the day in the last 4 years, so we're actually spending the whole month talking about it.
Oh, that's wonderful. Well, you need a whole month to talk about it. There's a lot of stuff to discuss with this. So a day, it doesn't just do it justice, does it?
It doesn't. It doesn't. So what we're trying to do is we, at Honoring Choices, we do two things. We try to make the tools to make your own healthcare plan free and accessible to everyone. So they're up on our website. But then we also give those tools to our partners like Care Dimensions and many folks. And together we all work with April Healthcare Decisions Month to put on events and information tables so that we could spread the word about how you make your own healthcare plan.
So that's great. So yeah, tell us more. Just so Honoring Choices again helps in terms of providing those tools, but you're really reaching out to a lot of people in terms of making sure that they get a lot of education around this.
Right. Well, we try to make it fun, believe it or not, because doing your own healthcare plan starts with a healthcare proxy, and that's pretty simple. That's where you choose someone you trust, someone who's going to be your advocate, to be your healthcare agent. And that can be done in Massachusetts. We do that in a very simple legal document called a healthcare proxy. So for April Healthcare Decisions Day, you can do this yourself. We have a do-it-yourself toolkit that everyone can do. It's on the Honoring Choices website. It's also on the Care Dimensions website in the resources section, because as I say, we partner, and it's so lovely to be able to do this together.
Absolutely, yeah.
So in April, anyone can go to either one of our websites and download that free Getting Started toolkit and start to make your own plan. You can do this for yourself. Anyone who's over 18 should really start with a healthcare proxy early on, and that kit will help you do it.
Yeah.
So you can do it yourself. Or the other thing, if you go to the Honoring Choices webpage under April Healthcare Decisions Month, we also have some really fun ways for you to do this in your community. You can do it at your church or your synagogue and your local library. If you have friends coming over for lunch one day, you can have a proxy party. So all of the tools are right there for free, right on the website for you.
You know, I think that's really important that you speak of this in terms of fun, because again, a lot of people, they shy away from this because they're so scared of this topic, you know, and again, it's so important. This does not have to be a scary thing. You can't, you know, but I think what happens for people is they wait so long that it's usually done with a crisis point. And of course, that's not a way that you can do it in a more lighthearted way.
Right.
So, you know, I think it's really important. So how do you get people to do this earlier on?
Well, I think part of what we need to tell people, and what we're trying to do at Honoring Choices, is to say this really is your right to do. Whether you're 18 or you're 108, as long as you have the ability to make your own decisions. These are your decisions. They're not your doctor's. They're not your fifth cousin once removed.
Right.
It's yours. And to take that seriously, and I think what we're finding with in Honoring Choices is that's what's fun, to tell you the truth, to be able to say, well, who am I going to choose to be my agent? Who do I really want to be my advocate? Who's going to speak for me? And even if I'm just ill for a little while and I expect to recover, it's wonderful to pick that agent, that advocate who's going to help talk to your doctors about what you need for care and help get you that care.
Right.
So I think we're finding with most folks, once they see the Getting Started Toolkit, they really feel quite empowered by it.
Yeah. Well, and I think that's the key, is that, again, a lot of times, when people are sick, or when there's a level of vulnerability that's associated with this, we are able to take charge of this.
Right.
And
Exactly.
and this is really a resource that can help one do this. People can have a voice and a say in what they want to happen for themselves. And I don't feel at times people have felt that way, that
Right.
empowered.
Yeah, and I think you're right about that. And one of the things we're trying to say to folks is this really is about your healthcare journey. This is about your whole life's journey. And no matter where you are on that journey, you can do this work.
Yeah.
So when we go and talk to, especially our senior community, or really anybody, we've talked to high schools even at this point. As soon as you hit 18, you really start this as an adult, this journey.
Yeah, and we have a graphic up about this journey, which is so important, Ellen. It's and like you say, I think we're always thinking about this stuff for the person who's really very sick or very old, and not even thinking about this. Like I'm sure some people are like, for kids in high school, you're talking about this? Absolutely.
Yeah.
And I often tell this story that, when my daughter turned 18, her doctor wouldn't talk to us anymore. I applaud the doctor because she was an adult.
Right.
And actually, she had to call the physician to say that you can give my parents information. That she's an adult, that's the way it should be done.
That's right.
And it's not always done that way. So, but we're not thinking about it in terms, and I think that's what happens for people is, it's not going to happen to me. I'm young.
Right.
This is, so they get a misperception about who really should be doing this.
Right. And I think we've taught people this, quite frankly, that you don't really need a healthcare proxy till you're older or sick. And that's not really what the law says in Massachusetts.
Yeah.
The law is so specific about this. It says you turn 18, you're an adult. You get to direct your own healthcare choices. My 30-year-old and 25-year-old sons spend a good amount of fair time in the emergency room because they play hard, they work hard, and sometimes they just get, bumped on the head or they get ill. And it's so interesting to see that their friends are right there with them. And so I think that generation understands this concept of not doing this alone, but having an advocate at the hospital or with your doctor to actually choose someone. In Massachusetts, we are really asked to choose, so that I give my right to someone else to say, only you. I want my doctor to only talk to you, even though there are lots of people who may love me and lots of people in my family. I'm picking that agent.
Yeah.
And that's what we want everybody to do during the month of April. And again, when we talk about that journey, it's everybody's on this journey, this healthcare journey.
Absolutely.
And we just think everybody needs a plan.
Yeah,
And
definitely.
whether we're healthy and 80 years old or healthy and 20 years old. When it gets a little harder, when we're working with chronic illness like diabetes or COPD, and then our conversations with our family and with our doctors tend to increase. They tend to get more serious about, how do I get the best care? How do I have my best days?
Sure.
And then as we progress into serious illness and end-of-life care, we see those decisions and discussions with our family and our doctors changing again. And so Honoring Choices has tools that have been developed by all of our care providers. They give us wonderful help, our doctors, our nurses, our folks in the community, our social workers, about how do we do this well and how do we do it together.
Yeah, and I think people do need the tools for their tool belt in terms of how to do this, because a lot of people are really, they just don't know where to start.
Right.
So, some of those, so I think it's a great guidance. Some of the tools that are in there in terms of those guidance, what do those include in terms of that?
Yeah, well, there's been such a popular tool is the Getting Started Toolkit.
Yep.
We tried to say, what's the law in Massachusetts and how do we bring this all together so consumers and families can really start to do this by themselves? Because the law says you can.
Right.
We don't have to wait. We can actually start to do it. So the Getting Started Toolkit is up on both of our websites, on the Care Dimensions website and on the Honoring Choices website. And it's a really 1, 2, 3 process. We're trying to say this is as easy, this first beginning part of your plan is as easy as 1, 2, 3. 1, if you can, choose a healthcare agent and a healthcare proxy. And so the kit has all that information on who you might want to choose and how to, and a free Massachusetts healthcare proxy itself you can download and just fill in.
Excellent. Yeah.
And then that second step is as important. So if I choose let's say I choose my sister to be my healthcare proxy. And even though she knows me well, I think if she's faced with really hard decisions, she might say, oh, I don't think I have enough information. What would she really want? So it's really important to do that number 2, which is to tell her what I want in a document called a personal directive.
Yep.
And we know that as a living will in Massachusetts. So that document is also in the toolkit. So you can appoint your agent and you can write down, here's what's important to me. If I get sick, here's what I'd like you to do. So it's instructions to your agent. And then that third step is we've done all this great work. We've talked to our agent. We've talked to our family. Now we have to talk to our doctors and our care providers.
Yep.
And that's what step 3 is there's a guide in there, a handy discussion guide for how you start conversations with your care providers. So that really
I think that's important.
it tends to
We
level that field.
assume that the healthcare person, right, or provider is going to initiate the conversation with us. Is that true?
Well, I think sometimes, but sometimes I think they're waiting for us to
Right,
initiate the
yes.
conversation.
Absolutely.
So that guide has actually been developed for consumers and for care providers. It's the same set of questions that we can both use together.
Yeah, that's wonderful. I think people need those levels of specifics because I think people, they haven't done this before. They don't even know what questions to ask. So they need to have that level of guidance. So, and just a couple of points of what you're saying, I think this Getting Started Toolkit is so important. So because people, assume that, geez, I know who I have to pick the person who's closest to me. Not always the choice that's really the right one, right?
Not always. It's tricky to choose an agent. And so again, in the Getting Started Toolkit, we have a guide that says, who do I choose and what are they going to do? What's the job they're going to have? I have 5 siblings, for instance, who are all close to me. And I think they probably all think they want to be my agent. And then there's my husband and my 2 children. So it's like, how do I do it?
Right.
But it's important for me to pick one.
Yep.
Because we've been in a situation, I think when my father was seriously ill, he's got a slew of grandchildren and children and in-laws, and we'd all rush the doctor, and say, what's going on? How can we help? Here's what I think you should be doing. And the doctor was smart enough to look at us and say, I'm going to tell you all, but I want to know who the agent is. Who's the healthcare agent? So it was really helpful for the doctors as well to be able to communicate to the person that I chose or, you would choose as your advocate.
Absolutely. Well, and again, it's important of who you choose because really you're not choosing you're choosing a person who is going to follow your wishes.
Right. Exactly.
They're not going to not to necessarily make those decisions for you and decide what they think is best. It's really a person who you want to honor your wishes.
That's right.
Truly, right? So, and that's, again, not always that person. So you have to have that conversation, which is another part that you said. The conversation is critically important.
It is. And I think that's what the tools help you do. They help you have the discussions you need to have. And then when you're ready, then you write down what you want for care and for those choices. They're really, and they will change over time. So that's why we want people to download this toolkit and own it and really hold their documents as their documents. So often our seniors will say, oh, I did that healthcare proxy 10, 20 years ago. My doctor has it or the hospital has a copy.
Yep.
And then I say, do you have a copy? Because that's what's more important, that you own that copy so you can make changes.
Absolutely.
Over time.
And things do change over time, right? So again, this is a fluid process, and this is forever. It adapts throughout your life cycle because things change throughout our lives. So things need to be tweaked as we go along. So because I think sometimes people worry about, I'm going to make this decision, it's engraved in stone, I can't change it. No, this is an ongoing process as things change in our health, in our life, and all of that, right?
Exactly. It's a really good point. I think in some way we have been taught about these documents to do them once and put them in your safety deposit box, and that's really not the correct message. They are living, breathing documents, and they represent you when you can't talk for yourself. Otherwise, it's your choice and you get to make these decisions all you want, as long as you're competent right through your lifetime. But the documents are there to back you up. That's your voice.
Yep.
You know, that's your right.
Absolutely. I think you make a great point too, because I think one of the things or reasons why people shy away from this is they feel like if I appoint somebody as my healthcare agent, I am relinquishing control. Not true at all.
Not true. And I know that's one of the fears. It's actually your backup.
Yes.
You know, that's what it is. I retain this right. That's what the Massachusetts law says. And let's say that if I get ill tomorrow, I get a bad flu and I'm in the hospital and I can't quite make decisions for myself. My agent steps right up and says, okay, Ellen's going to be sick for a little while. I'm going to make those decisions. But the minute she gets better,
that's right.
It's her right to make decisions again.
Absolutely. And that's the piece I like people to know is that, again, that person, just because a proxy is there, it doesn't mean a person has control or say.
Right.
That has to be activated.
That's right.
That you have to have been determined to lack capacity. And like you say, it could be for a short time or for a longer period, but you have to be determined to lack capacity before that does take charge. Because a lot of times I'll see that with families, they'll come in, no, I'm my mother's healthcare proxy, and the person still has capacity.
Right. That's
Somebody's not going to take over for you when you're still capable.
Yeah, and what we find that helps people to know about the law in Massachusetts is that's a medical decision when you lack capacity.
Yeah.
So your agent, you know, we have a lot of wonderfully well-meaning daughters and sons who want to help their mothers and fathers, but they actually can't decide to just step up as the healthcare agent. Right. It's a medical decision. Your doctor has to make the evaluation and say that person lacks capacity to make safe, effective decisions before the agent can step up. So that gives you some control over it.
Absolutely. So now you said, so you have the toolkit for the getting started.
Right.
Now, as you go along, there's another piece to this toolkit. Tell us about that.
So the Getting Started toolkit does what it says. It just really gets you started. And then as you go along on your journey and your healthcare changes, there are other tools. And we have that in the Next Steps toolkit. And that's where you see people really entering into chronic illness and then, again, a serious illness. So, for instance, we'll have other discussion guides to bring in to start talking about those chronic illness, because those questions really change about what kind of care is best for me, how can I find that care in the community, and with and then the toolkit will advance to people who are at end of life or who are living with a serious illness, and we start talking about palliative care, which I know Care Dimensions does so well, and hospice care, and that's part of that end toolkit. So we are so fortunate to have many of our care professionals and community leaders. They contributed these question and answer articles. So we have a lot of great information on the website. We also have that healthcare proxy translated into 10 languages.
That's wonderful.
Yeah,
because that's really important. Because again, a lot of times, you know, people are not reaching this. That again, because of language barriers and such.
A lot of barriers.
So that's wonderful. Yeah, so, you know, and again, you know, I think it's so important, again, that people have access to these tools because they don't know how to start. They're just, again, they can't even have the conversation because they don't want to talk about it, you know, because if they talk about it, something bad's going to happen.
Right.
It means, you know, we come across this too, and is that these conversations, like you said earlier, are so empowering. So what advice would you give people when they're still so resistant to, you know, what do you say to them?
Well, you know, I was talking with a gentleman recently the other day who was in that position. He was about 75 years old and started to have some pretty serious chronic illnesses. And he had been afraid most of his life to do that healthcare proxy because he thought that meant I was giving up my control. So once he saw the Honoring Choices kits and we talked about it, he not only understood that this was a really important decision for him, but for his family, that this is such a gift to your family. It will protect his right, which he was very happy about because he wanted specific things at the end of his life. And I said, great, write them down. You got to put them in the documents so that people can respect that right. But then he saw how important this would be for his family to see not only his decisions, but his own words. the personal directive is a wonderful tool for that, where you actually kind of write down your own words, and it's been such a powerful piece for families.
Yeah, that's wonderful.
And it also helps your doctors. As our doctors say to us continually, they're wonderful. They work with Honoring Choices. You know, we can't read people's minds.
Right.
We really have to, they really need to tell us what are your values? What's important to you at any stage of your health care?
Sure.
So that I can match the best possible care.
Yeah, and that's just good quality care, right? And I think, you know, in the past, it's not what people have always experienced. And I think, you know, that's certainly a part of hospice and palliative care that I value so deeply. It's truly what you're talking about, understanding, given the person's medical issues, what their options are, that they know their options, understanding the person's priorities and aligning those together.
Yeah.
And that's not always what happens. So again, a total empowering thing. I feel that we're moving in the right direction with this, don't you?
I do, and I do think there's been a dramatic switch in the last couple of years, because we really are trying to empower both sides of the equation here. Consumers and families to take hold of this and say, you know, what do we want? We do have more control. This medical system can be confusing. It can be hard to negotiate. But starting with the documents, we found a family who did this together actually just over the holiday this past weekend. They took the healthcare proxy and they were having, in this case, an Easter dinner, and they had made 10 copies because there were a lot of adults in the room, and they said, you know, we want to talk about this together. And it was a very empowering moment to come together for them. And now the mission was today, on Monday, to get it into their medical record, to give it to their doctors. And that's the piece that I think has felt really empowering for people. To know it's in their medical record so that their doctors can find it and see it.
Well, because some people will go so far. And again, you almost have to set deadlines and goals for yourself to kind of get these things accomplished. Because, you know, people are well-intended and sometimes say, oh, I've got to do that. But you know what that means. It turns from weeks to days, you know, days to weeks to months, you know, and it never gets done.
Right.
So
the healthcare proxy, and that's what we hope in April, that people will download these kits. They're actually pretty fast. If you have an agent to appoint on a healthcare proxy, you're simply filling in their name, their address, and their phone numbers. You can choose an alternate agent if you want. So that's that backup agent in case you can't get the first one. And then you simply need 2 witnesses in Massachusetts, anybody who's over 18. And what they do is they watch you sign. They witness the signature on my own healthcare proxy. They sign after me, and that's it. And you have a legal document. That's already
and that's important too. This is a legal document because people worry they don't fill out some of these things because they think, well, I can't afford it. I can't go to, and you're saying, because I can't go to an attorney. I can't do this. I can't afford this. What you're talking about
is free. And that's why we started Honoring Choices, because the law says this is your right. But there was this disconnect about, how do I find the documents? Do I have to go to an attorney? You don't. You certainly can. Attorneys have all these documents. If you feel like you'd like some advice around your entire estate plan and those documents, it's great to do.
Absolutely.
But you can also do it yourself.
Yes. It shouldn't prevent, and again, sometimes when people do go to attorneys, they have a nice package with these things in it. But for those who can't, it shouldn't prevent one from having these documents in place.
That's right. Yeah, and the law supports that in Massachusetts. This is your right. Starting at 18 years old, everybody gets to do a healthcare proxy. So we just wanted to bridge that gap, and our partners do this every day. We have hundreds of partners across the state, including Care Dimensions. And as a partner, you help to give out those tools and make them accessible to everyone you work with. Absolutely. So that's how that works.
And we do. We have a lot of people, and we utilize the resources all the time. We also try to make sure, though, that and really encourage people, because it should be done earlier. It's so important that people kind of get an earlier jump on this. Take control of your life, then it's behind you, and then you can just focus on the things you enjoy in life, right? Because you have this all set for yourself.
Well said.
So tell us too about, so how can people reach out? How can they get to others in terms of helping them with this process?
Well, what has happened recently, Honoring Choices is about 5 years old, and it really became this big, wonderful, collaborative event for everyone. And so we were helping the care providers and the community health organizations by giving them tools. And in doing that, we saw a lot of just regular, everyday folks who were so passionate about this subject. Usually, once they did their healthcare proxy, they wanted to tell their neighbor, they wanted to tell the people at church or in their synagogue, they wanted to go to the library. So we now have a new program called Healthcare Planning Ambassadors, where we can take that Getting Started toolkit and give it to anybody, any interested community member, any volunteer, just anyone even who has a passion for this.
We have a nice graphic up about this right now, about the ambassador program. So tell us more about that.
It's been a lot of fun. People in the community who you maybe wouldn't expect, who feel passionate about making sure that people start to talk about healthcare planning and take more control of their healthcare. So as an ambassadors, it can be anybody, anyone at all, who would like to tell others in their community. And there's a really powerful thing that goes on between person to person and peer to peer discussions. It's different than talking to your doctor or your care provider. You're talking to your neighbor. So we train people in the Getting Started toolkit. Again, it's a pretty easy do-it-yourself kit, but we have these spring ambassador workshops coming up, actually.
That's great.
And it's been a lot of fun to have people come in from all over the community, all walks of life. Wonderful stories about how the healthcare proxy helped them and helped their mothers and fathers, and they just want to move that forward, pay it forward a little.
That's wonderful.
Yeah.
That is an effective tool to have that word of mouth, because again, when somebody else has had that kind of an experience, they want to share that.
Right.
We find it all the time, even with hospice care or palliative,
Right.
So one of those best experiences when people have a success with that, to bring it to other people.
Yeah.
Well, that's wonderful. Where is the some of the ambassador programs that you have coming up?
So we have 6 of them across the
Oh,
state. We
wonderful.
got very popular very
Good.
fast.
Excellent.
So on the North Shore, if that helps, there's one coming up on April 26th at the Beverly Council on Aging.
Wonderful.
But if you want to see others, the Metro West one is going to be at the Bedford Council on Aging. But it's
Excellent.
all on the Honoring Choices website.
Great.
You just go to the ambassadors page, and you can sign up. We just ask, it's free. We just ask people that we register so we know who's coming.
Sure. Yeah.
And then we get you the training and the Getting Started toolkit, and then you can start talking to people in your community.
Well, that's wonderful. So let's talk, we only have probably another minute or so to go, but the time goes by so fast. This is such important. We could go on and on about this topic. But talk about, again, let's just make sure that people have access to these tools.
Sure. So again, anyone can do this. And if you go to the Honoring Choices website, and I think that's the link.
So we have a good graphic up right now so people can see that Honoring Choices website.
Right, you just type in, if you just Google in Honoring Choices, it will come up.
Very good.
And you'll start to see all the toolkits right there.
Good.
But if you, there's a special tag right on the top of the page that says April Healthcare Decisions Month, and if you just hit that little click that, it will open to the Honoring Choices page, and you'll see the Getting Started toolkit, easy download. If you want to have a little proxy party in your neighborhood, pizza and proxy seems to be a very popular one. We give you all the tools to do that too.
That's wonderful. So anything else you want people to know before we wrap up?
Well, this has been such a rewarding journey for me as an attorney and just as a everyday person, to see that we can help people feel like they can really direct their healthcare choices. And what we're also finding is our doctors and our nurses and our social workers use these tools as at the same time so they can have really effective discussions. So it's been a wonderful journey, and I thank Care Dimensions for all the work you've done for so many years in helping people really feel empowered about their care and honoring their values and choices.
Well, thank you so much, and thanks for being on the show. It's really been a pleasure
You're
having
welcome.
you here, and thanks for sharing this information with our audience.
Thank you, Mary.
Well, thank you for joining us on Timing is Everything, and we look forward to your tuning into our next show.
Care Dimensions, formerly Hospice of the North Shore in Greater Boston, is different in that we do more than just hospice.
It's just incredible, the services they provide when people need it the most. So being able to offer more individualized care helps people feel more cared for.
Because it's about the patient's quality of life.
I don't think there's any place else in the Boston area like Care Dimensions.
At Care Dimensions, we'll take care of your family like you're a part of ours. Visit us at caredimensions.org.